Hi, Dr. Dana Brindisi here with Carolina Functional Neurology Center. Today we're going to be talking about migraines and migraine syndromes. There are four main components that contribute to patients that suffer from migraines, and we're going to talk about each one of those today. Migraines are the most common neurological disorder in the United States and affect about 38 million people. Women are affected more often than men, and the age range of affected patients or pupils is anywhere from 25 to 55 years of age, typically. With that being said, we see patients that suffer at a very young age, and we see patients that have been suffering for a very long time that come to see us at ages above 55. So the reason why we see a lot of success with migraines is because we address all four of these components of the migraine syndromes all at once. So oftentimes we hear that patients have tried the medications, they've done the nutritional aspect of things, they've had an elimination diet, they've been gluten-free, they have had their adjustments, they've gotten their acupuncture, they've had their hormones tested, they've done all of these things and oftentimes have had treatment, and sometimes they still suffer. We find the reason why those patients that still suffer, even though they've done all of these really great therapies, is that they are usually multifactorial, which means that some people have anywhere from one to all four of these components being affected. So when you address just one of those components, oftentimes you may see some relief or no relief at all because one of these other components is not being addressed. At Carolina Functional Neurology Center, we specialize in neurological rehab and brain health. So we look at your system as a whole, and we evaluate you as a whole person, and we try not to isolate individually your brain or your heart or your gut or your musculoskeletal system, because they all are connected and they all make us the health of those individual pieces make us a healthy whole. So when we talk about migraines specifically and we talk about neurology, oftentimes we see dysfunction in certain areas of the brain. When we talk about those areas of the brain, we're really looking at your autonomic nervous system. And your autonomic nervous system is what controls all of those things that we don't think about. Your heart rate, your blood pressure, your digestion, your sweating, your pupil sizes. In migraine sufferers, oftentimes there is dysfunction in the autonomics, and when you come in for an evaluation, we run you through a full autonomic evaluation to understand if this part of your brain is functioning appropriately. The other parts of your brain that we see are dysfunctional are brainstem mechanisms, and we evaluate this oftentimes through eye movements, and we look at a lot of eye movements to understand different windows into your brain. So there are two components of your brainstem that house our ability to control and activate our eye movements appropriately. And then also part of your brainstem called your pontomedullary region is what helps to control your autonomics as well. The other part is your thalamus. The thalamus is really a relay center, and it plays a major role in sensory integration. So when we talk about chronic pain syndromes, today specifically we're talking about migraines, your thalamus can play a big role in being able to modulate that activity in addition to different parts of your brainstem as well. So moving on from neurology, we look at nutrition. One of the biggest factors in nutrition that contribute to migraines is blood sugar. So oftentimes we see patients, and when we run their lab work, when we talk to them prior to them coming into their new patient appointment, we hear, I've had all the testing done, I've had a bunch of lab work done, all of my tests come back normal. We hear that all the time, and a lot of you hear that as well. So when we talk about nutrition, not only do we look at blood sugar regulation, we don't want to be on the end of trending towards diabetes. We also don't want to be on the end of trending towards hypoglycemia or having low blood sugar. So our blood sugar is also connected to our hormonal function. So this is a big piece that some people are missing, even though they're eating relatively healthy food. the regulation of their blood sugar throughout the day may be a big issue for them. And so that's something that we look at very closely for our patients. In addition to this, we look at food sensitivities. So sensitivities are a little bit different than allergies. So sensitivities, when we test for them, we're looking at IgG and IgA activation of your immune system. When we talk about allergies, we're looking at IgE, and that's what most people understand to be a true allergy and can contribute to anaphylactic reactions like to peanuts or bee stings or things like that. Both of these play a big role. Food sensitivities can significantly irritate our gastrointestinal system. The health of our gut is intricately connected to the health of our brain and our nervous system. So understanding this aspect of migraines is huge, not only for making sure that your nutrition is good, but also to make sure that the communication between your gut and your brain is appropriate and functional. Number 3, we're looking at biomechanics. Our spine, our musculoskeletal system is communicating with our brain all the time to let us know where we are in space. That's called proprioceptive input. When we talk about biomechanics and migraines, we see often that the upper cervical area of the spine, so right at the base of your skull, where the base of your skull meets the top of your spine, you have a lot of small musculature in there. You have nerves and blood vessels that exit the base of the skull and traverse the scalp. When you have issues in biomechanics in your, not only your upper cervical spine, but in your neck and your upper thoracics as well, it can significantly influence your neurological function and overall neurological health. So when we talk about biomechanics, well, oftentimes you have a sore neck, you have poor posture. These things contribute significantly to migraines, but the communication between what's happening with our spine and what's happening with our brain is often affected in patients that have migraines. And again, when we talk about these 4 different components, some people have one. If it's just the upper cervical area, oftentimes those patients do really, really well with chiropractic care and adjustments. If they have a biomechanical issue and also a nutritional issue, and one is being addressed without the other, oftentimes they may not see the results that they're looking for in terms of overcoming their migraine. Number 4, hormones. One of the biggest things that we look at for migraines is adrenal function. Our adrenals produce a lot of hormones, especially when we talk about migraines. We're looking at cortisol. Our cortisol is hormones that help to control our sleep-wake cycles. Our sleep-wake cycles are intricately connected to our blood sugar. When we have poor blood sugar control during the day, we have poor cortisol or inappropriate cortisol output at night. Oftentimes, patients that suffer from migraines don't sleep well. This is a big factor to their overall ability to recover from the migraines. And as you start to see the pattern, one of these often affects the other 4. So this is why we take a comprehensive approach and we look at all of these things when we talk about migraines. We run diagnostic tests here in the office looking at functional neurological issues as well as nutritional and metabolic syndromes. So these are the 4 main contributing factors to migraines. I hope you guys learned something today. And if this video was helpful to you, please like and subscribe to our YouTube channel. And you can comment below and ask us any questions that you have about migraines, neurological health, nutrition, biomechanics, anything like that. And we are going to work hard to answer all your questions. Thank you again, Dr. Brindisi with Carolina Functional Neurology Center.